So our clients that have the diagnosis of COPD or CHF, one of the biggest things that we're challenged with a lot of times is because of the disease process. It's hard for them to be compliant, or we just don't have a lot of compliance. What's great about Recovo is, again, one of the benefits of it you have to think about is you're getting more compliance and more time with that client participating in actual functional tasks or doing things as opposed to having a conversation. That translates to better outcomes because they're more engaged in the session. So for example, a lot of our patients, COPD, CHF, but patients that are sitting, what can I do with them in physical therapy that's going to help? So if we take the Recovo sensor, and I'm going to show you first on my knee, and then I'm going to show you on my ankle. But what I'm trying to get them to do is to participate with me for at least a 2-minute. You can challenge them, or until they actually fill the entire screen. So that just involves, a lot of times if we want to work on the balance and challenge more sitting on the edge of the chair, right? Because they might be chair bound. But they're literally just marching in place, moving the leg abduction, induction, flexion, and they're spending 2 minutes doing it. And as we know, 2 minutes is a long time for a lot of those clients. So just having them do it, and what they're engaged in is their attention is seeing if they can fill the screen completely in those 2 minutes. So they're intrinsically trying to figure out and before they know it, because I can tell you if you ask somebody to march in place for 2 minutes and there's nothing else going on, it becomes a really long period of time and you really have to deal with the compliance issue. So try it on their thigh, bringing it down to the ankle. If you want to work on some range of motion with that, having them move it, holding that quad so that they're actually getting quad strength as they're sitting on the edge is a great challenge, and we're not even getting the client up. But at the same time, as they're moving and trying to figure out that Recovo artwork, they're filling the screen, and before they know it, they've actually done exercises for 2 minutes. We're reminding them to breathe properly because of those disease processes. You can also do it standing. The important thing that is so great about this is people are compliant and they're doing the sessions for longer. You're justifying your time in there. And if you're not sure, use it. So how about another one of our tools that we use to demonstrate that we're making a difference for these patients? Because that's what the insurances want to know, right? So single leg stance, how long can that client stand on one foot? As we know, if it's less than 5 seconds, they're more at risk for falls. Well, if they're practicing the Recovo and they're actually drawing something as they're standing on one foot, first of all, we're doing dual tasks, which demonstrates that they're able to do more than one thing at a time, and that decreases their fall risk, but also engages their brain so that they're standing for a longer period of time. And as they're using the Recovo, they're actually concentrating on that versus how long they're standing. So we're actually getting a longer single leg stance, measuring them before doing the Recovo, and then measuring them after.